went to see the doctor, things started happening, and that's when you got very upset, obviously very scared, very shaky, and the doctor just pulled the alarms. The alarms were going off everywhere. They said you're going to give birth, and you don't really, I mean, obviously as a man you don't really know, you don't know what it means. You think, oh, my babies are coming today, and okay, 26 weeks is early, right? So okay.
You thought they'd just be small.
I got a passing glance at them, but they were straight into the hands of the paediatricians, tubes down the throat. Oh, sorry. I haven't thought about this for so long. So yeah, they had the tubes down the throat. The doctors were battling to make sure they were okay, and I was with Soph. And then they were just whipped off into the NCU. And that was that. And yeah, I got to see them, the little bodies, and they were. And the next 5 hours was horrible because they wouldn't let us see them. That was when you crumbled, and I just thought, oh my God, this is really serious.
The closest we got to any kind of disorder was, they said, because Joey couldn't breathe for himself, and they said we're going to have to give him steroids to get the tube out, because they kept trying, and it was damaging his throat. Children born that early are 80%, 90% likely to go on to be autistic. I was concerned that they weren't hitting their milestones and were doing things that other kids weren't doing, so I asked for an individual assessment when they were 2 years old, and in the assessment they were asking me lots of questions, and I kept saying, no, they don't really play with other kids, they're not really interested in books, they're not, they like to play with doors.
Oh, yeah, I've forgotten that.
They like to do things like that, so repetitive play.
Doors and switches, we couldn't take them anywhere.
Who's that one? Oh, that's the really tricky one, we never remember her name. She looked at me and she said, they're probably autistic. And I just was like, I lost all my words completely, and I went, but not really. No, they're probably autistic.
It's a banana.
He slipped on a banana skin.
That's when you knew something was bad. Something was bad and something was delayed with both of them, and it wasn't, you just think, well, maybe it's just one, but no, it's both. It's bad. And you think maybe it's just mild because they have got good eye contact. That was really like, it's just going to be mild. It's a big spectrum. People kept saying it's a big wide spectrum, and maybe it's just mild, But I remember asking that question. They said if you're being diagnosed at 2, it's not mild.
3, yeah. 3. They said it's probably moderate to severe.
Yeah.
And that was another.
That was a real kick in the teeth. That was.
Snowberries. These are snowberries, said Baby Bear. When they were 4, we started having regular cranial sessions at home, and it was really amazing the difference it made.
Yeah.
Without us saying anything, our therapists would just put their hands on their head or their tummy and say, oh, has he been a bit upset this week emotionally? Or is he a bit, just things, and I think, oh my goodness, this is really strange, but yes.
And hearing the kind of diagnoses of what they go through just from the way that they were being touched or manipulated was quite amazing. And then disregarding how the impact that it was having, which was profound, we kind of used it as our barometer for how they were doing.
I'm Spider-Man.
We were told early on that progress is the most important thing with autistic children. Just keep seeing that progress. Obviously we're trying to close a gap with neurotypical children, but as long as they're progressing, their vocab's progressing, their kind of anxiety levels are getting better and better. And we've put them on a path now with the massive help of Craniosacral, and they're progressing so well, and they're on a big upward curve, and to the point where we're not getting too ahead of ourselves. Maybe we think they're closing the gap on kids their age or within their kind of age bracket to get to the point where they've caught up, or they're the quirky kid as opposed to the autistic kid.
Can we fix it? Yes, we can!
Every day we touch wood and just hope that they keep progressing the way they are, and then I think we know they'll be alright.